Welcome to the Deep Dive, where we take your sources, peel back the layers, and really try to unearth the most vital insights and maybe some surprising facts.
Yeah.
Our mission today is to cut through, some of the noise and give you a comprehensive, clear understanding of some deeply personal and often pretty complex topics around pregnancy. Everything from the initial journey to conception through the different ways people become parents, and also including difficult decisions like abortion.
Right.
We're digging into several articles from BabyCenter today,
Right.
a well-known resource for pregnancy and parenting info.
Yeah.
And we want to bring you the key facts you need to be genuinely well-informed.
Exactly. And this is, well, it's a sensitive area, no doubt, but it's incredibly important.
Absolutely.
We'll be looking at the medical side of things, like abortion procedures, but also the legal landscape, which is changing so fast right now.
Yeah, it really is.
And just how common abortion actually is in the U.S. That might surprise some people. But beyond that, we're also exploring some different, maybe more modern ways people build families.
Oh, like what?
Like egg and sperm donor parties. Heard of those?
I think I have, vaguely. Sounds interesting.
It is. So, yeah, our aim is really to synthesize all this information, give you the context, and hopefully empower you with knowledge, encourage some critical thinking about, all the nuances involved in these decisions.
Okay, so let's unpack this. What exactly are we looking at today, and what can you, our listener, expect to gain from this deep dive?
Well, we're going to clarify what these processes actually involve.
Right, the nitty-gritty.
Exactly. And explore the different factors that shape these really personal choices. And also, importantly, highlight the resources that are available out there for support.
Sounds good. It's all about understanding the full picture, isn't it? From the biological start to the very human decisions that come after. Okay, so before we get into the specifics of reproductive choices and all the options, maybe we should just briefly touch on the starting point for a lot of people, that journey to conception.
Yeah, absolutely.
It seems straightforward, maybe, but the sources kind of hint it's not always like that, right?
No, not at all. That's actually one of the really striking things that comes through, how unpredictable conception can be. Some couples, the sources say it happens right out of the gate, like almost immediately.
Yeah, you hear those stories.
You do, but then for others, well, they might find themselves trying for years. It really challenges that idea that starting a family is always simple or easy.
Right.
You hear these very personal conception stories, and they just highlight this huge range of experiences. There's no single way it happens.
So that initial path, just trying to get pregnant, can be complex in itself.
Exactly. And recognizing that complexity up front, I think it sets a really important foundation for understanding that, well, reproductive journeys in general are often complicated. They might need patience or sometimes, active medical help.
That makes sense.
It's just a vital reminder that everyone's path, whether it's to parenthood or facing a pregnancy decision, it's totally unique to them right from that very first step of trying to conceive.
That really does reframe the starting line, doesn't it? Puts it in perspective.
Yeah.
So if the path to pregnancy isn't always direct, what does this mean when maybe someone faces an unexpected pregnancy? Or when they're actively making choices about how they want to build their family? Where do things go from there?
That's a really good segue into one of the big topics in our source material today, the details around abortion. The articles mostly talk about it as a medical procedure, and they mention two main methods. For someone who maybe only has a vague idea, what's the basic takeaway? How do abortions actually work?
Okay, the most essential thing, the key takeaway, is that when it's done by a licensed healthcare provider, both of the main methods are considered safe.
Okay, safety first.
Absolutely. The sources are really clear. There are two primary approaches. You've got surgical abortion and then medication abortion, which people often just call the abortion pill.
Right.
And it's just crucial to emphasize that professional medical supervision is key for safety, no matter which method someone chooses.
Makes sense.
They both end a pregnancy, obviously, but they do it through different processes, different timelines. So it gives people choices based on their situation, how far along they are, that kind of thing.
Okay. So maybe we should break down each method then.
Yeah, let's do that. It helps to really understand the differences.
All right, first up, medication abortion. That's the one commonly called the abortion pill. What actually is it, and how does it work, practically speaking?
Well, the first key thing to know is that it's not actually just one pill, despite the name.
Oh, okay.
It's a sequence of two different medications that work together. The first one is called mifepristone.
Yeah.
You might sometimes hear the brand name Mifepri.
Mifepristone.
Got it. Right. And its job is basically to stop the pregnancy from developing further. It does this by blocking a hormone progesterone, which is really crucial for maintaining the uterine lining.
So it stops supporting the pregnancy. Exactly. It causes the lining to thin, and it prevents the embryo from continuing to grow. It's kind of like telling the body, okay, stop supporting this pregnancy now.
Okay. And then there's a second medication.
Yes. Usually about 24 to 48 hours later. So a day or two the second medication is taken. This one's called misoprostol.
Misoprostol.
Right. And this one is typically taken at home, which offers some privacy and comfort.
And what does that one do?
Misoprostol works differently. It causes the cervix, that's the opening to the uterus, to soften and open up, and it makes the uterus contract.
Ah, right.
These contractions then expel the pregnancy tissue. A lot of people describe the feeling as similar to a really heavy period with strong cramps and maybe passing blood clots.
Okay. And how effective is this method, and is there a time limit?
It's very effective, especially earlier in pregnancy. The sources say the success rate is between 93 and 98%.
Wow, that's high.
It is. But it's generally not recommended after about 10 weeks of pregnancy. The main reason is that its effectiveness tends to decrease as the pregnancy goes on.
Right, that makes sense. So once someone takes that second medication, the misoprostol, what's the actual experience like? What should they expect, and what kind of support is, recommended?
Okay, so after taking misoprostol, you should definitely expect significant cramping and quite heavy bleeding.
Like that heavy period comparison.
Exactly. That's the body's natural response as it expels the pregnancy tissue. The sources describe it like a very heavy period, often with clots.
And how long does that last?
Well, the most intense part usually happens within about 24 hours of taking the misoprostol. But the bleeding itself, it can continue, gradually getting lighter for maybe about 2 weeks.
2 weeks, okay.
Yeah. So during that initial intense period, it's highly recommended to be somewhere comfortable and private where you can just rest.
Right.
And ideally, it's good to have someone you trust with you just for support.
Yeah, having someone there sounds important. What about managing the pain?
For pain relief, simple over-the-counter options like ibuprofen or acetaminophen are usually suggested. But here's a really critical warning from the sources. Don't take aspirin.
Oh, why not?
Because aspirin can potentially increase bleeding, so definitely avoid that.
Good to know. Any other side effects?
You might also experience some temporary things like chills, maybe a low-grade fever, or some nausea after taking the misoprostol, but those should typically go away within about 24 hours.
Okay.
And importantly, your healthcare provider will give you detailed written instructions about everything, what to expect, what's normal, what's not, and they'll give you a direct phone number to call if you have any concerns or questions. You're definitely not left to figure it out alone.
That's reassuring. What about recovery afterwards?
Yeah.
And are there any really critical safety warnings people absolutely need to know, especially about getting these pills?
Yeah, post-procedure care is really important, both for comfort and for safety. Most people find they can get back to work or school the day after taking the second medication.
Okay, fairly quick then.
Usually, yeah. But it's definitely wise to avoid any heavy lifting or really strenuous exercise for a few days, just to let your body recover fully.
Right.
And for at least a week afterwards, the advice is to avoid using tampons or having sex.
Why is that?
It's because the cervix remains slightly open after the abortion, which slightly increases the risk of infection getting into the uterus.
Ah, okay. Makes sense.
But things like swimming or taking baths are generally considered fine.
Good to know. What about birth control afterwards?
That's a really important practical point. Pregnancy can actually happen again surprisingly quickly after an abortion.
Really? Okay.
Yes. So immediate birth control is highly recommended if you want to prevent another pregnancy right away. Some clinics can even offer an implant or a shot on the same day you take the first pill, the mifepristone.
Oh, convenient.
Yeah, or an IUD insertion would usually need a follow-up visit once the abortion process is fully complete.
Okay. Now, about those safety warnings,
Hmm.
especially getting the medication.
This is absolutely paramount. The sources are emphatic. You should never buy abortion pills from unapproved websites online.
Right. That sounds risky.
It is. Both mifepristone and misoprostol are prescription medications. They must only be used under qualified medical supervision. That's for both safety and effectiveness.
So talk to your doctor or clinic.
Exactly. Your healthcare provider is the best person to guide you. They can direct you to FDA-approved pharmacies or legitimate organizations like Aid Access, which can legally and safely ship these medications if that's appropriate for your situation.
Okay. Are there situations where medication abortion isn't the right choice? Like medical reasons?
Yes, absolutely. There are specific medical conditions or circumstances called contraindications where medication abortion isn't recommended.
Such as?
For example, if someone has severe anemia or a condition called chronic adrenal failure, or, very importantly, an ectopic pregnancy.
That's where the pregnancy is outside the uterus, right?
Exactly. In the fallopian tube, usually.
Yeah.
Medication abortion won't work for that, and it's a medical emergency.
Okay. What else?
It's also generally not advised if you're taking certain medications like blood thinners, anticoagulants, or long-term corticosteroid therapy, or if you currently have an IUD in place.
Can the IUD be removed?
Often, yes. The IUD can usually be removed, and then you could proceed with the medication abortion if otherwise suitable.
Okay.
And of course, if someone has a known allergy to mifepristone or similar drugs, that would rule it out too.
So if medication abortion isn't an option for someone for these reasons,
Then their healthcare provider can thoroughly assess their situation and discuss whether a surgical abortion might be a safer and more appropriate alternative for them.
okay, that's really comprehensive. And it immediately makes me think about, well, what if something goes wrong? Complications, even if rare. How does someone handle that, especially with all the concerns about privacy now and the legal situation being so messy?
That is such a critical point, and the sources address it directly, especially considering the current environment.
Yeah.
While complications are rare, as we've said, you'll get very clear instructions from your provider about what to expect, what's normal bleeding versus too much, and you'll have that direct contact number for concerns.
Okay.
For instance, if someone experiences excessive bleeding, and they usually define what that means, like soaking through pads quickly,
Yeah.
the advice is clear, go to the nearest urgent care or emergency room.
Right. Get medical help.
Absolutely. But here's where the emphasis on patient privacy comes in really strongly. The source explicitly states you are not required to tell the medical staff, doctors, nurses, anyone that you've specifically had a medication abortion.
You don't have to say, I took the abortion pill.
Exactly. The source says, quote, "I'm pregnant and I'm bleeding," is all you need to say.
Wow.
That level of disclosure or non-disclosure, it doesn't impact the emergency medical care you need. The treatment for heavy bleeding is the same regardless of the cause.
And that applies to family or friends, too. You don't have to tell them.
Absolutely not. It's your personal medical information. You have the choice to share, of course, but you are never required to.
Okay. But what about those states where abortion is now illegal or heavily restricted? Is there extra caution needed there?
Yes, and this is a crucial warning in the source material. For individuals living in states where abortion has been criminalized or severely restricted, the advice is actually to consult specific hotlines, like the one run by the National Abortion Federation, before seeking medical care for potential complications.
Why before?
Just to understand your rights and any potential legal risks or implications in that specific state's environment before you walk into an ER. It's an unfortunate reality, but an important safety step now.
That's a lot to navigate.
It is.
Yeah.
But understanding the process, the safety steps, and your rights, especially around privacy, it's all part of being empowered in these situations.
Okay, so that really covers medication abortion in detail. What about surgical abortions? The sources mention two main types, suction abortion, often called D&C, and then dilation and evacuation, or D&E. How do these differ? What's involved?
Right. The main difference between these two surgical methods really comes down to the stage of pregnancy.
Okay.
But both are typically performed by a doctor or a specially trained nurse practitioner, and they involve using specific medical instruments to gently remove the pregnancy tissue from the uterus.
Is it painful? What about anesthesia?
For both procedures, the cervix, again, that's the lower part of the uterus, is numbed using local anesthesia.
Just numbing that area.
Yes, and often you'll be offered sedatives as an option. These help you relax and reduce discomfort, but you're still conscious, maybe just drowsy.
What about being put completely to sleep? General anesthesia.
That's actually rare. Even if the procedure happens in a hospital, general anesthesia usually isn't necessary for these types of abortions.
Okay. And any other prep?
Yes, standard safety measure, you'll typically get oral antibiotics beforehand just to prevent any potential infection.
Got it. So let's talk about the first type, suction abortion or D&C. When is that used?
Okay, so suction abortion, which you might hear called a D&C, that stands for dilation and curettage, even though suction is the main technique now.
Right.
This is the most common type of surgical abortion, and it's typically performed in the first trimester of pregnancy.
Where is it done? Clinic? Hospital?
It can be safely done in several settings: a provider's office, a dedicated clinic, an outpatient surgery center, or sometimes in a hospital.
Okay. And the process itself.
It starts with dilating or gently opening the cervix. This can be done either with medication given beforehand or by inserting thin rods called dilators that gradually widen the opening.
Does that take long?
Sometimes, yeah. If the pregnancy is a bit further along, say closer to the second trimester, this dilation process might actually start several hours or even the day before the main procedure to make sure the cervix opens enough.
Okay, so cervix dilated. Then what?
Once it's dilated, a thin, flexible tube is gently inserted through the vagina, through the cervix, and into the uterus. That tube is connected to a suction device, which gently removes the embryo or fetus and any related pregnancy tissue.
Is that it?
Sometimes the provider might also use a small spoon-shaped instrument called a curette.
A curette.
Yeah. They might use it to gently scrape the uterine lining, just to double-check that no tissue is left behind. Ensures completeness.
How long does the actual procedure take?
The suction part itself is surprisingly quick, usually only about 5 to 10 minutes.
Well, that's fast.
The procedure is, yeah. But the whole visit, including the prep time, the procedure, and then a short recovery period afterwards, that might take a few hours altogether.
Okay, so that's the first trimester method. What about later in pregnancy? You mentioned D&E.
Exactly. For later stages, specifically in the second trimester, so generally after about 13 or 14 weeks of pregnancy, the procedure used is called dilation and evacuation, or D&E.
D&E, okay. Where is that done?
Similar settings, actually. It can also be done safely in a provider's office, a clinic, an outpatient center, or a hospital.
And how does it differ from the D&C?
The basic steps are similar in concept, but because the fetus is larger in the second trimester, the main difference is that it requires more significant dilation of the cervix.
More opening needed.
Right. So that dilation process, again, using medications or those dilating sticks placed in the cervix, will often start the day before, or at least several hours before the actual evacuation procedure.
Takes longer to prepare.
Typically, yes. And in some specific cases, especially later in the second trimester, an injection into the abdomen might also be needed as part of the preparation.
Okay. And during the D&E procedure itself, what happens?
The doctor will use a combination of medical tools. This might include the curette we mentioned, but also specialized forceps, possibly other instruments, along with suction, to remove the pregnancy tissue.
So, a bit more involved.
A bit more involved, yes, reflecting the stage of pregnancy. The procedure itself usually takes a bit longer than a D&C, maybe somewhere between 10 and 20 minutes.
Okay, 10 to 20 minutes. And what about recovery after these surgical abortions? Similar to the medication one or different?
The post-procedure care for surgical abortion has a lot in common with medication abortion recovery. But there are a few specific things.
Like what?
Well, immediately after the procedure, you'll spend at least 30 minutes, maybe longer, in a recovery room right there at the clinic or hospital.
Why is that?
Just so the medical staff can monitor your vital signs, blood pressure, heart rate, make sure you're feeling okay, check your initial bleeding, and ensure you're stable before you head home.
Makes sense.
And before you leave, you'll get those detailed instructions for home care, what to watch out for, and that emergency contact number, just like with the medication abortion.
Okay. What about symptoms afterwards? Cramping, bleeding.
It's pretty common to have some cramping for a day or two, and you might have some bleeding for up to 2 weeks.
Up to 2 weeks again.
Yeah. But interestingly, the sources also say some people have hardly any symptoms at all afterwards. It varies.
Okay. And returning to normal activities.
Usually you can go back to work or school the day after the procedure and resume most normal activities. But again, that advice about avoiding heavy lifting or really strenuous exercise for a few days still applies. Just give your body a chance.
And the advice about tampons and sex, same.
Exactly the same. No tampons, no sex for at least a week. Again, it's because the cervix is still slightly open and that reduces the risk of infection.
But swimming and bathing are okay.
Generally, yes. Those are fine.
And birth control. Still need it right away.
Absolutely. Critical point again. You can get pregnant again very quickly after a surgical abortion, just like with the medication one. So immediate birth control is highly recommended once you resume sex.
Can you get an IUD right then?
Yes. That's often a convenient option with surgical abortion. Some clinics can insert an IUD or a contraceptive implant on the very same day as the abortion procedure.
Oh, okay. That's helpful.
Yeah, it really is. So looking at them side by side like this, you can really see the differences in timing, the techniques involved between the main types of abortion. Hopefully that gives you, our listener, a much clearer picture of what each one actually entails. Hashtag 2.3 cost and resources for abortion.
Okay, let's talk about something really practical.
Hmm.
Cost. It can be a huge barrier for people needing any kind of medical care, and abortion's no different, right?
Hmm.
What do the sources say about how much it costs, and maybe more importantly, where can people find help if they can't afford it?
Yeah, that's a really pressing question for so many people. The sources give a general range. They say the cost of an abortion, whether it's medication or surgical, typically falls somewhere between a few $100s up to maybe $1,500.
That's quite a range.
It is, and a couple of key things influence that cost. Medication abortions generally tend to be less expensive than surgical ones.
Okay.
But remember, medication abortions is usually only an option earlier in pregnancy, typically up to that 10-week mark.
Right.
And crucially, the cost of any abortion generally goes up significantly the further along the pregnancy is. Later procedures are just more complex, so they cost more.
That makes sense. Are there other costs to consider?
Yes, absolutely, especially now. If you happen to live in a state where abortion access is limited or banned, you might face really substantial additional costs.
Like travel?
Exactly. Travel expenses, gas, maybe bus or plane tickets, possibly needing lodging, meals if you have to stay overnight. Those costs can add up incredibly fast and become a huge barrier on top of the procedure cost itself.
Wow. Okay, so what about insurance? Does health insurance ever cover abortion?
The situation with insurance is really varied. Some private health insurance providers do cover all or part of the cost.
But not all.
Not all. And even government health plans like Medicaid or TRICARE, whether they cover it depends heavily on the state you live in. State laws dictate Medicaid coverage for abortion, and many states restrict it.
So you have to check your specific plan and state rules.
Definitely. The best advice is always to call your insurance plan provider directly to ask about your specific coverage. Or you can check online resources, the sources mention, abortionfunds.org and Medicaid, to see if your state's Medicaid program covers abortion.
Okay.
And here's an interesting point the sources mention. Some employers are actually starting to offer financial assistance to help their employees travel for reproductive health care, including abortion, if they live in a state with restrictions.
Oh, that's a newer development.
It seems to be, yeah.
Yeah.
Recognizing the access challenges people are facing.
Okay, that's helpful if you have insurance or maybe that kind of employer support. But what about people who don't have insurance or whose plan doesn't cover it? Are there places they can turn to for financial help?
Yes, absolutely. And this is where some really critical support organizations come in.
Good.
If you want abortion but you're worried about affording it, there are several key organizations specifically set up to provide financial and logistical help. You can contact the National Abortion Federation or Planned Parenthood or the National Network of Abortion Funds.
Okay, NAF, Planned Parenthood, National Network of Abortion Funds.
Right. These organizations are specifically equipped to help you find clinics that might offer services on a sliding scale, meaning the fee is based on your income, or clinics that offer payment plans.
That could make a big difference.
Huge difference. They can also connect you with local agencies or community groups in your area that might provide direct financial assistance to help cover the cost of the abortion itself, and sometimes even help with those travel costs we talked about.
So they're like hubs for finding funding.
Exactly. They are truly crucial lifelines for many people trying to navigate these complex financial and logistical hurdles.
Can we give out some contact info for those? That seems really useful.
Yeah, absolutely. The sources provide these, so let me give them to you. Planned Parenthood can be reached at 800-230-PLAN. That's 800-230-7526.
800-230-7526.
Got it. The National Abortion Federation hotline is 800-772-9100.
800-772-9100.
Oh, the National Network of Abortion Funds doesn't have a single hotline, but their website connects you directly to local funds in your area.
Okay, search National Network of Abortion Funds online.
And there's also the All Options Talk line. Their number is 888-493-0092. They offer not just practical info, but also unbiased emotional support no matter what you decide.
That's good too. 888-493-0092.
And finally, the Abortion Care Network is another resource. Their number is 202-419-1444.
202-419-1444.
Great. Yeah, providing these specific contacts really highlights the reality of the financial challenges, but also, importantly, shows that there is a strong network of support out there trying to help people access the care they need.
Okay, so we've covered the procedures, the costs, the resources. Let's kind of zoom out now and look at the wider context of abortion in the U.S.
Right, the bigger picture.
How common is it, really? And what is the current legal situation? I feel like it's changing constantly.
It really does. And this is where we get into the societal and legal landscape. The sources give us some pretty critical statistics and definitely highlight those significant recent legal shifts.
And just a reminder, we're reporting the facts from the sources here, staying neutral on the legal changes themselves, right?
Absolutely. Strict neutrality. Just conveying the information provided about what the law is and how it's changed.
Okay, so first off, how common is abortion?
Well, here's a fact that often surprises people. Abortion is actually a very common experience in the United States.
How common?
According to the American College of Obstetricians and Gynecologists, nearly 1/4, almost 1 in 4 women in the U.S. will have an abortion at some point in their lifetime.
1 in 4. Wow. That's much higher than I think many people realize.
It really is. It means statistically, many people you know, friends, family members, colleagues, have likely had an abortion even if they haven't shared that experience.
Any other interesting stats?
Yeah, another one that challenges stereotypes. The majority of individuals who have abortions are actually already parents.
Oh, really? Not primarily young, first-time parents.
No, the data shows most are already mothers. And the sources also make a point to state that transgender and non-binary people have abortions too, reminding us it's not exclusively a cisgender women's issue.
Right. Important point.
In terms of recent numbers, back in 2020, almost 1 out of every 5 pregnancies in the U.S. ended in abortion.
1 in 5.
Yeah.
Okay. What about trends over time? Have the rates changed?
Yes, significantly. Abortion rates actually hit their peak back in the 1980s.
Okay.
Then, for several decades, they saw a pretty steady decline.
Why was that?
Well, it's generally attributed to a combination of factors. Better access to and use of effective birth control played a big role, but also in some areas, increased restrictions on abortion access likely contributed to the decline as well.
So a mix of things. What about more recently?
More recently, there was actually a slight increase in abortion rates between about 2017 and 2020.
Oh, interesting. Any idea why?
The sources don't delve deep into the reasons for that specific uptick, but since 2020, especially after the major legal changes, the trend seems to be sloping downward again. And that's very likely due to the significantly decreased access to abortion care in many parts of the country now.
Right, the access issue again. And the reasons why people choose abortion, I imagine those are incredibly varied and personal too.
Absolutely. It's far from being a single reason or situation. The sources list a whole range of deeply personal, often very complex reasons.
Like what kind of things?
Things like someone just not feeling emotionally ready or maybe not financially able to raise a child right at that moment,
Yeah.
or feeling they're either too young or perhaps too old to provide the care a baby needs. Sometimes people feel overwhelmed by other responsibilities they already have, maybe caring for other children or elderly parents.
Right, life circumstances.
Exactly. Or just feeling very strongly that it's simply not the right time for them to have a baby, given their life situation.
Are there more difficult reasons mentioned?
Yes. Tragically, reasons can include the pregnancy resulting from rape or incest. For others, it might be that they never intended to get pregnant at all. Maybe they thought they couldn't, or they just didn't want to become pregnant at that particular time.
What about medical reasons?
Yes. Medical reasons are also significant factors for some. This could be learning through prenatal testing that the fetus has a severe chromosomal abnormality, a serious genetic disorder, or a major birth defect that might mean a very difficult life or incompatibility with life.
That must be heartbreaking.
Absolutely devastating decisions. Or it could be a situation where continuing the pregnancy poses a serious danger to the pregnant person's own life or health.
So really a huge spectrum of reasons, all deeply personal.
Totally. And it's worth mentioning, too, some practical things that might come before an abortion. These vary a lot by state now.
Like waiting periods.
Yeah, some states might require you to go to a clinic for counseling or information first, and then have a separate appointment, maybe 24 or 48 hours later, for the actual procedure. These rules change constantly with state laws, so you always have to check what's current.
Okay. And when can you actually get an abortion? Is there a minimum time?
Some providers might prefer to wait until you're 5 or 6 weeks pregnant, often because it's easier to confirm the pregnancy location on ultrasound then, but many will provide the service as soon as a pregnancy test is positive, which can be as early as 4 weeks.
Good to know. What about preventing pregnancy after unprotected sex?
Crucial point the sources make. If you've had unprotected sex within the last 5 days, emergency contraception like Plan B or Ella is still an option that can prevent pregnancy from starting in the first place.
Right. EC is different from abortion.
Completely different, yes. It works before pregnancy begins.
Okay. One more thing from this section. The sources mention a warning about Crisis pregnancy centers. What's that about?
Yes, this is a really important warning. People need to be aware of these centers. They often have names that sound like legitimate health clinics, maybe using words like Women's Center or Pregnancy Resources.
Oh,
But they are typically run by anti-abortion organizations. And the crucial thing is, they do not provide abortion services.
so they won't actually help you get an abortion.
No. And worse, the sources warn they may actually provide misleading or false information about abortion or pregnancy, and sometimes use pressure tactics to try and persuade people not to have an abortion.
Wow. How can you tell the difference?
The advice is to be direct and ask up front about the specific services they provide. Ask them clearly. Do you provide abortions here, or do you offer referrals for abortion services? If they're evasive or won't give you a straight answer on the phone about offering abortion or truly unbiased options counseling that includes abortion, they're probably not a legitimate comprehensive healthcare provider. Stick to trusted sources like Planned Parenthood or INAF for reliable info and services.
That's really vital information. Thanks. This whole section really helps humanize the statistics, showing the diverse reasons and the complex situations people face. It reinforces that it's just a profoundly personal decision. Hashtag 3.2, legality and safety. Okay, so we understand the personal side better, but let's shift back to that broader context, specifically the legal status of abortion in the U.S. now. You mentioned it's changed dramatically. Can you break that down?
Yes, this is where things get really critical for understanding who can access abortion care and where. The entire legal foundation shifted dramatically in June 2022.
That was the overturning of Roe versus Wade, right?
Exactly. The Supreme Court's decision in the Dobbs case overturned Roe v. Wade. That decision ended the constitutional right to abortion that had been in place for nearly 50 years.
So what does that mean practically?
It means there's no longer a federal standard protecting abortion rights. The legality of abortion is now entirely determined by individual state legislatures.
So it varies massively from state to state.
Massively. As of the time the sources were written, right after the decision in June 2022, 8 states had already moved to outlaw abortion almost entirely, often through pre-existing trigger laws.
And more were expected to follow.
Yes, the expectation was that many more states would either ban abortion completely or enact extremely severe restrictions, making it practically inaccessible.
Can you give us a little historical context? What was it like before Roe v. Wade?
Before the Roe decision in 1973, abortion was generally illegal across most of the United States.
And was it unsafe then?
Very often, yes. Because it was illegal, procedures were often performed in unsafe, unregulated conditions by people without proper medical training. Or, tragically, women would resort to dangerous, self-induced methods out of desperation.
That sounds terrifying.
It led to a horrifyingly high number of deaths and severe life-altering complications related to these unsafe abortions. The sources cite data from 1965 showing that illegal abortions were responsible for almost 1 out of every 6 deaths related to pregnancy and childbirth back then.
1 in 6. Staggering.
It really highlights the public health impact of illegal abortion. Then, Roe v. Wade in 1973 changed things. It legalized abortion nationwide, establishing it as a constitutional right based on privacy.
What did Roe actually say?
Essentially, the ruling prohibited states from banning abortion before fetal viability, the point at which a fetus could potentially survive outside the womb. Doctors generally estimate viability to be around 24 weeks of pregnancy currently.
But even with Roe in place, states still put restrictions on abortion, didn't they?
Yes, absolutely. Even during the nearly 50 years Roe was law, many states, and sometimes the federal government, continuously enacted various restrictions. Things like mandatory waiting periods, bias counseling requirements, parental involvement laws for minors, restrictions on funding, and regulations designed to make it harder for clinics to operate.
So the recent overturning of Roe just opened the floodgates for even more restrictions or outright bans.
Precisely. The current situation, as the sources describe it, means that accessing an abortion is now much, much harder or completely impossible for people living in over half of the states in the U.S.
Wow, over half.
Yeah, and in some of those states with very restrictive laws, like bans starting at 6 weeks, it can be incredibly difficult to even find a clinic or get an appointment before that deadline passes, especially since many people don't even realize they're pregnant that early.
So the advice is really to act quickly if you're considering abortion.
The sources strongly emphasize that. Talk to a healthcare provider about your options as soon as possible, because time might genuinely be a critical factor depending on where you live now.
Okay, that's a really stark picture of the legal situation and its history. Let's pivot now to something equally crucial: the safety of abortion itself. There are so many myths and, frankly, a lot of misinformation out there. What do the sources say based on actual medical facts?
Yes, this is incredibly important to clarify with solid, factual information cutting through those myths.
So is abortion safe?
The sources are unequivocally clear on this. Having an abortion is extremely safe when the procedure is done or the medication is prescribed and managed by a licensed, qualified healthcare provider.
Extremely safe. Safer than what?
Well, here's a comparison that often surprises people. Legal abortion is significantly safer for almost all individuals than continuing a pregnancy and actually giving birth.
Really? How much safer?
According to the American College of Obstetricians and Gynecologists, serious complications from abortion are rare at any stage. But the risk of death associated specifically with pregnancy and childbirth is about 14 times higher than the risk of death associated with a legal abortion procedure.
14 times higher risk from childbirth than from abortion.
That's the statistics cited, yes. It really puts the relative safety into perspective.
Okay, what about those common myths? Like, does abortion cause breast cancer or depression?
The sources directly tackle these. They explicitly state that claims linking abortion to an increased risk of breast cancer or depression are myths and untruths.
Not supported by medical evidence.
Not supported by reliable medical evidence, no.
And what about future fertility? That's another common concern you hear, that having an abortion will make it hard to get pregnant later.
That's also described as extremely unlikely. The sources affirm that the vast majority of women who have abortions go on to have perfectly healthy pregnancies and healthy babies later on, with no issues related to fertility caused by the abortion.
So basically, when performed legally by trained providers, abortion is a very safe medical procedure with low risk of complications, and it doesn't cause breast cancer, depression, or infertility.
That's the clear message from the medical information presented in these sources. It's vital to counter the misinformation with these facts. Hashtag 3.3 emotional effects of abortion.
Okay, moving from the physical safety to the emotional side. Given how personal and sensitive this decision is, what do the sources tell us about the emotional impact of having an abortion? It often gets painted in very black and white terms.
Yeah, and a really critical insight here is that there's absolutely no single correct way to feel. The sources really emphasize this. Every woman responds differently, and there are no right or wrong emotions.
So a whole spectrum of feelings is normal.
Totally normal. While some people report feeling, maybe primarily, immense relief after ending a pregnancy they didn't want or weren't prepared for,
Which makes sense.
others might experience strong feelings of guilt or sadness or maybe regret. And many, perhaps even most, experience a really complex mix of these emotions, sometimes simultaneously, sometimes shifting over time. And that's all considered a valid part of processing a significant life event like this.
Are there factors that might make the emotional response more intense or maybe make someone need more support?
Yes, the sources identify a few things that might increase the likelihood of stronger feelings or a greater need for emotional support afterwards.
Like what?
One factor is the reason for the abortion. If the pregnancy was ended for health reasons, either to protect the pregnant person's own health, or because the fetus was diagnosed with a serious health problem or a condition incompatible with life, those situations can understandably bring up more complex grief or sadness.
Right. That's a different kind of loss.
Exactly. Another factor can be a personal history of mental health challenges, like depression or anxiety prior to the pregnancy. That might make coping with the emotions afterwards more difficult.
Okay.
And also, very importantly, the level of social support someone has. If people close to you, your partner, family, friends, don't support your decision to have an abortion, that lack of support can make the experience feel much more isolating and emotionally challenging.
That makes total sense. So if someone is feeling upset or overwhelmed or confused after an abortion, what's the advice? What should they do?
The clear recommendation is find someone to talk to. Don't bottle it up.
Who can they talk to?
It could be a trusted friend or family member who is supportive. It could be the nurse or doctor at the clinic where they had the procedure. They often have experience with this. Or they can reach out to a dedicated support talk line or helpline.
Are there specific ones mentioned?
Yes, the All Options helpline, that number again is 888-493-0092, is specifically highlighted as a really valuable resource.
Why them specifically?
Because they offer free, confidential, and importantly, unbiased support from trained peer counselors. You can talk openly about your feelings and experiences, whatever they are, without any judgment. They support people through all pregnancy and parenting decisions.
That sounds incredibly helpful.
It really does. This whole section, I think, does a good job of validating that huge range of emotional experiences. It moves beyond those simplistic, often judgmental narratives about how people should feel after an abortion, and it strongly encourages seeking support. It underlines that there's no one way to feel, and help is available. Hashtag tag 3.4 risks of abortion.
Okay, so we've established it's generally extremely safe. But like any medical procedure, there must be some potential risks. Even if they're rare, what are they and what should someone watch out for?
Right. And the sources do outline these while always stressing that they are very rare and usually easy to treat. But yes, it's important for anyone considering abortion or supporting someone who is to be aware of the potential just for safety and preparedness.
Okay, so what are these rare risks?
One possibility, though again rare, is what's called a failed or incomplete abortion.
What does that mean?
It means that either the medication didn't fully work or during a surgical procedure, not all of the pregnancy tissue was removed from the uterus.
What happens then?
It would require a follow-up. This might involve needing another dose of medication, or more likely needing a simple vacuum aspiration procedure in the clinic to make sure the abortion is fully complete.
Okay, what else?
Another rare risk is infection. This could happen after either a medication or a surgical abortion.
How's that treated?
If an infection develops, it's typically treated effectively with a course of antibiotics prescribed by the provider.
Okay, infection. What's next?
Heavy bleeding. While we talked about bleeding being normal, especially with medication abortion, in very rare instances, the bleeding can be excessive. In extremely rare cases, it might even require medical intervention like a blood transfusion, but that is highly uncommon.
Right, very rare.
Very rare. Then there's a very low risk of injury to the cervix, the uterus, or other nearby organs during a surgical procedure.
How could that happen?
It's possible, though unlikely, that the instruments used could accidentally create a small hole or tear. The sources put the risk of this kind of complication at less than 1 in 1,000 procedures.
So very low risk.
Extremely low. The risk might be slightly higher if someone has certain pre-existing conditions like large uterine fibroids, or if they've had a previous C-section, or if the pregnancy is further along. But even then, these injuries remain rare.
Okay, any other potential risks?
In extremely rare cases, someone could have an allergic reaction to the medications used, either the abortion pills themselves or maybe anesthesia or antibiotics. That would, of course, need immediate emergency medical attention.
Right.
And lastly, another rare complication mentioned is blood clots forming inside the uterus after the procedure. These can cause severe, persistent cramping and might also need a follow-up vacuum aspiration procedure to remove them.
Okay, so a list of rare but possible issues. Given these, what are the absolute red flags? The warning signs that mean someone should definitely call their doctor or clinic right away, or maybe even head to the ER.
That's the crucial practical takeaway here, knowing when to seek help promptly. The sources give a very clear list of symptoms that warrant an immediate call to your healthcare provider.
What's on the list?
You should call immediately if you experience severe abdominal or back pain that isn't getting better, is getting worse, or isn't helped by the usual pain relief medication.
Okay, severe pain.
Heavy bleeding. And they give a specific guideline. If you are soaking through 2 thick, full-size maxi pads per hour for 2 consecutive hours, that's the key metric.
2 pads per hour for 2 hours straight. Got it.
Any foul-smelling discharge from the vagina, that can be a major sign of infection.
Okay, bad smell.
A fever of 100.4 degrees Fahrenheit, that's 38 degrees Celsius, or higher, that doesn't come down.
Right.
Or specifically after taking misoprostol, the second pill in medication abortion. If you experience persistent weakness, severe nausea, vomiting, and/or diarrhea that lasts for more than 24 hours.
Okay, prolonged sickness after the second pill.
Exactly. Having this clear list of potential, though rare, complications and knowing exactly which symptoms mean call now, it really empowers you, the listener, with critical practical knowledge. It helps ensure safety, whether it's for yourself or maybe for a loved one going through this. It stresses being prepared and knowing when to get help without delay.
All right, so we've thoroughly explored abortion. The procedures, the context, the safety.
Yeah.
But the sources also talk about other significant choices people might consider when facing a pregnancy. Specifically, deciding to become a parent or choosing adoption.
Right.
If we connect this back to that bigger picture of reproductive journeys, how do these other options fit into the conversation?
Well, thinking about the bigger picture, discussing parenting and adoption alongside abortion is all part of this larger, really evolving conversation about reproductive autonomy, right? And also about the amazing diversity of family structures we see today.
Yeah, families look so different now.
Exactly. It's about recognizing there isn't just one right path when facing a pregnancy or wanting to build a family. There are multiple valid paths, and each one comes with its own unique set of joys and challenges. The sources really try to offer insights into how individuals can be supported whatever choice they make, always emphasizing that idea of informed personal decision-making in every single scenario.
Okay, let's start with the choice to become a parent, or maybe to expand an existing family. What do the sources emphasize about taking that path, both practically and emotionally?
The sources definitely acknowledge that having a child, whether it's your first or you're adding to your family, can be incredibly rewarding, a really transformative life experience.
Yeah.
But they're also very realistic about the demands involved. A key insight is that becoming a parent or adding another child really requires having a strong, consistent support system in place.
You can't do it alone.
Pretty much. The advice is to actively lean on your loved ones for help. Talk openly with other parents, friends, family, colleagues, people who've successfully navigated the challenges of raising kids. Learn from them.
Okay. What else should people consider?
It's recommended to think really deeply about how you'll manage the impact, the emotional impact, the logistical impact, like childcare, time off work, and of course the financial impact of adding a child.
It's a lot more than just finances.
Oh, absolutely. It's about the demands on your time, your energy, your sleep, your relationships. And if you're becoming a parent for the first time, the sources suggest taking some time to reflect honestly on what your expectations of parenting actually are.
Because reality might be different.
Exactly. The day-to-day reality can often be quite different, maybe much more complex and demanding than what you might initially imagine. So it's really a call for honest self-assessment, figuring out your resources, and leveraging your whole community for support. It emphasizes that this journey is rarely meant to be done completely solo.
Right. That makes sense. Now, what about the path of adoption? How do the sources present that as an alternative?
Adoption is presented as a really significant and often deeply compassionate choice. It's where someone decides to continue their pregnancy, go through childbirth, and then legally terminate their own parental rights so that another individual or family can adopt and raise the child.
Providing a home for the child and allowing someone else to become a parent.
Exactly. It can be a loving choice for everyone involved. The sources do note, though, that adoption laws vary a lot from state to state,
How so?
particularly regarding the rights of the biological father, whether his consent is needed, whether he needs to also terminate his rights. State laws also dictate the level of contact, if any, the birth parent can have with the child after the adoption.
That's the open versus closed adoption thing, right?
Precisely. Open adoption might involve ongoing communication, sharing pictures, maybe even visits between the birth parents and the child and adoptive family. Closed adoptions, historically more common, mean there's usually no identifying information shared and no contact. The trend now seems to be more towards openness, but it varies.
If someone is considering adoption, where should they get information?
The recommendation is to seek out reputable, unbiased adoption agencies or experienced adoption attorneys who can answer all your questions thoroughly and supportively. You really need to understand all the legal aspects, the emotional considerations, what you're agreeing to.
Is there anything to watch out for when looking for legal help?
Yes, a really crucial point the sources make. Most adoption attorneys legally represent the adoptive parents, not the birth parent placing the child.
Oh, okay. So their loyalty isn't necessarily to the birth parent.
Legally, no. So it's highly advisable for a birth parent considering adoption to find their own independent attorney who specializes in adoption and can advocate solely for their interests and rights throughout the process.
That's really important advice. Can abortion providers help with info on adoption too?
Yes, definitely. It's important to know that many abortion providers and family planning clinics, like Planned Parenthood, are set up to provide comprehensive and unbiased information on all the options available to someone facing an unintended pregnancy.
So they'll talk about parenting, adoption, and abortion.
Exactly. Their goal is usually to support the individual in making the decision that's best for them, without any pressure towards one option over another.
And that helpline again, all options.
Yes, the All Options Talk line 888-493-0092 is mentioned again here specifically as a place to get help weighing these incredibly personal choices. They can help you talk through your feelings and the pros and cons of each path, totally without bias, just helping you find clarity.
Great. It really feels like this section provides a balanced view, showing support is there for whatever path someone chooses.
Hmm.
Okay, now this next part, it shifts gears quite a bit, doesn't it? It brings us to something really fascinating and, well, very modern sounding, egg and sperm donor parties.
Right. It's quite something.
When I first read about these, my first thought was just, wait, what are these exactly? And how did this even become a thing?
It's a really delightful and actually quite insightful trend, I think. The sources do a great job explaining how these parties are gaining traction and what they really symbolize beyond just, clicking through donor profiles online.
So it's more than just picking DNA.
Oh, much more. There's a quote from Julia Carroll, who's a solo mom by choice. She puts it beautifully. She says these gatherings are a celebration of one's choice to become a parent and a celebration of how they want to become a parent.
I like that, a celebration of the how.
Exactly. So the main purpose isn't just selection. It's really about marking a major life milestone. It's about destigmatizing the selection process, which can often feel very clinical, very private, maybe even a bit lonely.
Yeah, I can imagine.
And it's about actively creating a sense of community around the prospective parent, showing them love and support as they embark on this huge journey.
Are they brand new or have they been around?
Well, they might seem really new, but the sources say they aren't entirely new. Julia Carroll mentioned they were already happening about 5 years ago when she started her journey. They're just getting more visible now, more talked about.
Why now, do you think?
Probably because of the increasing normalization of all kinds of diverse and alternative ways people build families today. IVF, surrogacy, donor conception, solo parenting, LGBTQ plus families. It's all becoming more open.
Makes sense. Who tends to have these parties?
The sources suggest they seem to be particularly common within the LGBTQIA plus community and also among people choosing to become solo parents. Maybe less common for heterosexual couples who are using donors due to infertility, though that could change too.
Why more common for solo parents or LGBTQ plus folks?
Perhaps because, as the sources hint, single parents by choice especially might be actively seeking more public ways to get support, to build their village, and to really celebrate their chosen path, pushing back against any lingering stigma about going it alone. It's like creating a new kind of family ritual.
That's actually really heartwarming, turning what could be a solitary, maybe stressful process into a shared, joyful event. What do parents who've actually had these parties say about the experience? What's it like?
Oh, the parent perspectives are fantastic. They paint such a vivid picture. There's Betty, a 41-year-old single mom by choice in Boston. She described her sperm donor selection party. She had 3 close girlfriends over. They had their laptops, maybe some wine.
Sounds fun.
Right. But she emphasized she was very intentional about who she invited. She chose friends she knew would give feedback based on her priorities, what she was looking for, rather than friends who might try to impose their own ideas or preferences.
Smart. Keep it focused.
Very smart. Betty recalled how they'd share profiles they liked, saying, "Any great catch we shared right away." And she said the best part was just all of the laughs that helped destigmatize the selection process. It made it feel less weird, more normal.
Yeah, humor helps.
Definitely. And she had this great quote. "A donor party is essentially a commencement, a celebration of intended parenthood, framing it like a graduation, a joyful beginning."
I love that analogy.
Me too. And for solo parents like Julia Carroll, these parties are also a really powerful way of saying, hey, I am proud of this choice I'm making. It underscores that importance of pride, joy, and cultivating a sense of community, especially when you're choosing a path that might still face some societal judgment.
And involving friends makes them part of the journey, too.
Exactly. By bringing people into this major decision, it helps make those friends and family feel really invested in the outcome, excited for the journey ahead. It transforms a potentially technical, maybe isolating task into this really meaningful communal rite of passage.
Okay, so on one hand, it sounds like this incredibly supportive, positive, celebratory way to start building a family. But what do the experts say, like the fertility doctors or specialists? Do they see any potential downsides? Or do they have specific advice for hosts or guests?
Yeah, the experts definitely chime in with some valuable perspectives, kind of balancing the clear upsides with some important things to maybe think about.
Yeah. What are the benefits they see?
Dr. Jessica Reineck, who's an obgyn specializing in fertility, she agrees that these parties can really help aspiring parents break the ice with friends and family they want involved. And critically, she says, it provides huge emotional support.
Makes sense.
She also adds, the donor selection process can be overwhelming, and hearing input from those that are important to you may help you think about things you may not have considered. So getting those different perspectives can be genuinely helpful.
But are there cautions?
Yes, a couple of things. Dr. Reineck points out one potential long-term consideration. Thinking about how any photos, videos, or even just detailed stories from the party might feel for the donor-conceived child to encounter later in life. It prompts thinking about how to share that origin story thoughtfully when the time comes.
That's a really interesting point I hadn't considered.
Right. And then Dr. Malene Chuang, another medical expert quoted, highlights a more immediate potential drawback. She warns that sometimes family members, even with the very best intentions, might unintentionally impose their own desires or expectations on the selection process.
Like pushing for a donor that looks like them or something.
Exactly. Or maybe focusing too much on certain traits they value, which might not be the host's priorities. Dr. Chuang warns this can actually become overwhelming or even feel burdensome for the hopeful parents, potentially turning a supportive event into something stressful.
Can it actually change someone's plans?
Well, the source gives this really vivid example from a TV show, ABC's Not Dead Yet. In one episode, a character is having an egg donor party, and his friends give such harsh critiques of the potential donors that he gets totally discouraged and decides to just pursue adoption instead.
Wow. So well-meaning feedback can backfire badly.
It really illustrates how sensitive this is and how overly critical comments, even if meant well, can genuinely derail someone's carefully made plans.
Okay, so given those potential pitfalls, what's the advice from experts for making these parties work well, for both the person hosting and the guests attending?
They offer some really thoughtful advice. For guests, Dr. Reineck suggests doing a little homework first. Yeah, like educate yourself and learn about the process, the fertility treatment, the issues around using donor sperm or eggs, and maybe the issues that may arise for donor-conceived children. Basically, come prepared so you can offer informed support, not just random opinions.
That's good advice. What else for guests?
Her main advice is really just to make sure the person knows you are there for them and best to avoid specific advice unless requested. It's more about showing up with empathy, listening, and offering encouragement rather than telling them who to pick.
Be supportive, not directive.
Got it.
What about advice for the person hosting the party?
For the host, Dr. Reineck suggests having clear boundaries and a clear outline of what support they're looking for.
Like telling people what you want from them.
Exactly. Be upfront. Do you want their active input on profiles? Or do you mostly just want emotional cheerleading and maybe some help lightening the mood with humor? Communicating those expectations clearly beforehand can prevent misunderstandings or hurt feelings.
Makes sense. Set the ground rules.
Right. So overall, while the experts acknowledge it's a delicate emotional process, the sources really conclude that starting down the path to parenthood, especially using donor conception, is a huge applause-worthy step. It absolutely deserves celebration.
So embrace the party, but thoughtfully.
Exactly. Hosts should communicate their goals clearly, and guests should aim to be kind, be supportive, be compassionate, help the host have fun, and just make them feel special and supported in this incredibly personal and exciting moment. It's a fascinating glimpse, isn't it, into how social norms around family building are changing, becoming more open, more communal, while also reminding us to navigate these new rituals with real care and empathy. #outro.
Wow, that really was a comprehensive deep dive, wasn't it? We've covered so much ground, from the very specific medical details of different abortion procedures.
Yeah, the nitty-gritty.
To the really complex and frankly confusing legal landscape that's shifting under our feet. We talked about how common abortion actually is, the range of emotional impacts, and then finished with these really innovative, even celebratory ways people are approaching building families now, like those donor parties.
Yes, we really covered a lot. And if you try to tie it all together, connect it to that bigger picture, I think the undeniable key takeaway is just how profoundly important informed decision-making is in all of this.
Informed choice seems central.
Absolutely. Whether it's understanding the medical methods accurately, figuring out how to navigate the costs, knowing what the legal situation actually is where you live, or preparing for the emotional side of things, having access to accurate, unbiased information is just paramount.
It's not about telling people what to choose.
Not at all. It's fundamentally about empowering individuals with the knowledge they need to make the choices that are truly right for them, for their lives, their circumstances, especially when the landscape around these topics can often feel so complex, so politicized, and just plain confusing. Having clear facts is crucial.
So what does this all mean for you, our listener? We've tried to unpack the complexities of these deeply personal topics, hopefully offering some clarity, maybe some surprising details along the way, from the precise steps of taking medication abortion at home to the communal joy possible in a donor selection party.
Yeah.
Our real hope is that you feel maybe a bit more equipped now to understand these different pathways, whether that's for yourself someday, or maybe just to better understand and support the people in your own life who might be navigating these choices.
And this whole conversation, I think it really highlights something broader too, how these incredibly personal decisions about our bodies, about our families, they aren't just medical issues or just
Yeah.
legal issues.
Not much more.
They're deeply intertwined with our personal values, aren't they? With our communities, with our support systems, and even with the creative, evolving ways we find to support each other and celebrate major life steps.
That's a great point, which leads to maybe a final thought.
Given how much everything we've talked about is constantly shifting, the medical technologies are advancing, the legal frameworks are changing seemingly month by month, social norms around what even constitutes a family are evolving so rapidly, it makes you wonder, doesn't it? How might future societal support systems, future medical innovations continue to shape and perhaps even fundamentally redefine the very meaning of family and parenthood in the years to come?
That's a fascinating question to ponder. How will it all continue to evolve? Definitely something to think about.